Dr. Ken Landau. Thanks for watching. Let's talk about fever. Understanding fever requires us to know a little bit about normal body temperature. The idea about 98.6 was established 1851, but just like with your blood sugar or your blood pressure or your heart rate, there's normal variation in temperature. Average is somewhere between 97 and 99.5. If we take it by mouth, if you're a mouth breather, it's going to be somewhat lower. Axillary temperature is somewhat more variable, lower than the oral temperature, somewhat inaccurate. Rectal temperature is about 3/4 of a degree higher than oral temperature. The idea about skin temperature, it's really tough to interpret. It doesn't really indicate what's happening inside the body. Depends whether we're taking the temperature of the forehead or over the bridge of the nose, where it's going to be a little bit lower, or over the actively metabolizing muscles, or over the liver, where it's going to be somewhat higher. The tympanic membrane temperature, the ear temperature, that's fraught with errors. Significant variation. We know that we can have the base temperature, the unadjusted temperature, or the adjusted temperature, all sorts of changes. If you really want to know what your body temperature is, what's happening in your core temperature, then probably the most accurate is measuring the lower esophageal temperature, but that obviously is impractical. Now, under normal circumstances, the human metabolism is going to produce more heat than is necessary to maintain the body temperature in the normothermic range. So we have an increased production of the heat by the muscles and by the liver, but at the same time, we have elimination of the heat through the skin and through the lungs. Now, under normal circumstances, there's going to be about a 1 degree variation in the body temperature over the course of a day. It's fixed in early childhood, but in some people who are recovering from febrile illness, that variation can be up to about 2 degrees. Actually, if we look at people between the ages of 18 and 40, we're going to find that the lowest body temperature is going to be about 6 o'clock in the morning, when the maximum normal temperature, should be about 98.9 degrees. The temperature is higher in the afternoon between 4 and 6 p.m. Then the maximum temperature should be no more than about 99.9 degrees. If it's higher than those particular timed limits, then you have a fever. Well, women who menstruate, in the first 2 weeks of the cycle, their body temperature is going to be somewhat lower, with ovulation continuing through the luteal phase until menstruation. Body temperature is going to be elevated by about 1 degree. But remember, they're still going to have that normal cyclic variation that I just mentioned. Now, if you have a febrile illness, for the overwhelming majority of people with febrile illnesses, that normal variation is still going to occur, but it's going to occur at a higher level. Have to be a little bit concerned about elderly individuals. Elderly individuals don't seem to have the same ability to develop a fever. So among seniors, even a small elevation of body temperature may be very important. Now, fever is defined as elevation of body temperature over the normal variation, and it occurs when an area of the brain known as the hypothalamus, that has a set point, moves the set point somewhat upward. It's sort of just like changing the thermostat in your house. Well, when you change the thermostat in the house, or you change the hypothalamic set point, what we're going to do is we're going to try to bathe the hypothalamus in warmer blood. Well, one of the first things that we want to do is get rid of the loss of heat through the skin. So the skin's going to become cold as the blood is shunted inward. So when you develop fever, skin tends to get somewhat colder. Well, if we look at people who are seeing physicians, say pediatric population, seeing pediatrician or general practitioner, about 1/3 of them seek medical care because of fever. Senior citizens, certainly, when they become seriously ill, about 3/4 of them have an increase in the body temperature. And it's not just an increase in the body temperature, it's other sickness behavior that occurs as well. So these are people who become lethargic or depressed or have a loss of appetite. They seem to want to sleep. Sleepiness is very common in people who have fever, or excess pain, pain in the muscles, pain in the joints. They have inability to concentrate. Now, theoretically, elevation of the body temperature is important. It's a defensive mechanism. But it's clearly shown that treating the body temperature when you're in the febrile range doesn't seem to delay the healing process. Now, there are some bacteria that do indeed require specific temperature limits. So if we get over those limits, well, that theoretically is going to help get rid of the infection. And there are some immune processes that seem to work better at a higher temperature. So the white blood cells are more active. They tend to engulf the foreign invaders somewhat better. The T cells seem to be somewhat more active. But in our modern society, in the developed world, those factors don't seem to be very important. Now, the hypothalamus, the area where the set point is, it's going to receive signals from two different areas. It's going to receive signals from the temperature of the blood that bathes the hypothalamus, and it's also going to receive peripheral neurons that are going to transmit information from the warmth receptors and the cold receptors that happen to be in the skin. And then the hypothalamus is going to modulate all of that. When you have a fever, your body temperature increases typically somewhere between about 1.5 and 3.5 degrees. You're going to modify some of your behaviors. So when you have a fever, you're going to put more clothes on. You're going to increase the amount of bedding that you have. You're going to try to decrease the heat loss. Then the body, if necessary, can start producing more heat. You have something known as the non-shivering heat production. That's going to occur from the liver initially. Later on, it can occur with shivering, which means the muscles are more active, and even later yet, because of some of the noradrenaline and other chemicals that are produced, it's theoretically possible to increase the fat cell metabolism, to increase the brown fat or the beige fat, which is more appropriate, increase their metabolism. They produce an awful lot of heat. And then, as a set point returns to normal, now all of a sudden you're going to feel hot. That's when you feel flushed. That's when you begin to sweat. What causes the change in the set point? Well, it tends to be as a result of some pyrogens. Pyrogens is Greek from fire. Well, we have these pyrogens that are produced external to the body or produced by the body itself. So the exogenous pyrogens, those include certain substances that bacteria make, for instance. So we have the gram-negative bacteria making lipopolysaccharides. We have some of the gram-positive organisms making the superantigens. Those are the staph and the strep. They all work in very tiny amounts. But then we have the endogenous pyrogens. We have the body that can manufacture the pyrogens by itself. That's through the process of inflammation or through activation of the immune system or even through some of the blood cells. Here we have the production of those cytokines, the cytokines that they talk about, the cytokine storm in COVID-19, but cytokines that incite rheumatoid arthritis and a variety of other inflammatory diseases like IL-1, interleukin-1, interleukin-6, tumor necrosis factor, interferon, all of those substances manufactured through a wide array of different kind of chemical processes in the body. Well, those pyrogens, they're in the general circulation. They can't get into the brain because of what's known as the blood-brain barrier, but they can get onto the endothelial cells, the cells in the blood vessels that line the area quite close to the hypothalamus. And when they do that, it seems that they can elicit the production of an enzyme known as COX. You know about COX because when you take the aspirin or you take the non-steroidal anti-inflammatory drugs, the ibuprofen, the naproxen, those are COX inhibitors. We have different kinds of COX enzymes. We have COX-1, COX-2, even COX-3, it's thought, in the brain. Well, the COX enzyme, it seems to increase the production of prostaglandin E2 in the hypothalamus, and that's going to cause the release of cyclic AMP, and that's going to increase the set point. That's going to increase your body temperature. Well, at some point in time, you're going to have return to normal. And when the set point sets downward, sets back to a normal range, that's when you're going to have vessel dilation in the skin. You're going to start to sweat, and it's going to continue to occur until the blood that bathes the hypothalamus gets down to the appropriate level. That's when you remove the excess clothing because you want to facilitate the heat loss. But we know that the hypothalamic set point can also be altered by some local trauma to the brain, hemorrhage inside the brain, infection inside the brain, tumors inside the brain. All of those can lead to an increase in the set point, and then we have a fever and we can't figure out what the cause is. Well, the normal temperature in some individuals can still indicate significant illness. Remember the senior citizens? So even at a temperature of, say, 99.6, 99.7, that can be a significant elevation for those individuals and need a medical evaluation. Now, there's another condition known as hyperpyrexia. Hyperpyrexia, when the temperature gets to be in excess of 106.7, typically that's, again, the central nervous system hemorrhage, bleeding into the brain, subarachnoid hemorrhage, a type of a stroke. And even in the pre-antibiotic era, it was relatively uncommon because it seems that the brain makes some neuropeptides, some chemicals inside the brain that act to bring the temperature down. Now, there's another condition, and that's an elevation of the body temperature without a change in the set point. That's known as hyperthermia. Typical example, of course, is heat shock. Well, in this condition, your body makes more heat than it can get rid of. And that's obviously a significant problem. So it can occur from exogenous reason, maybe because you're outside in a very hot, humid environment, especially if you happen to use your muscles. That's endogenous heat production. So you're outside on a hot day and you're working relatively strenuously. And if you do that, well, that can lead to heat stroke, but it also can be a sign of abuse of amphetamines or cocaine or an idiosyncratic reaction to a certain kind of drug. Serotonin syndrome, variety of conditions can cause that. Well, it's very important to realize that's different and has to be treated differently than a set point elevation. So in a set point elevation, your skin's going to be cold because of the vasoconstriction. Well, in heat stroke, the skin tends to be very hot and quite dry. Well, additionally, we know that it can be pretty difficult to distinguish which you're suffering from. Are you suffering from fever through the normal route, or are you suffering from the hyperthermia? We have to know what other kind of situation exists. So, for instance, if you happen to be doing a marathon in the summertime, chances are it's heat stroke. Heat stroke has a very high mortality rate as opposed to just a fever. The mortality of heat stroke can be up to about 60%. So within the first hour, you've got to bring the temperature down to less than 102. Otherwise, we have the inflammatory cascade. We're going to have a tendency to coagulation. And interestingly, there's a high incidence, like about 50%, of people who have heat stroke who actually have bacterial infection. Where did the bacteria come from? Came from the gastrointestinal tract, because at those high temperatures, we have increased permeability of the cells in the gut, and they allow bacterial translocation from the intestine into the system. And interestingly, it's found that in dogs with heat stroke, they actually have improved survival when they're treated with an antibiotic. And also, when you develop heat stroke, it's also going to affect the kidney function. Well, if we look at fever overall, we find that fever can be non-serious, or it can actually be a life-threatening condition, a manifestation of a life-threatening condition. So fever can come from a viral infection, bacterial infection, parasite, upper respiratory infection, sometime more likely appendicitis or diverticulitis, COVID-19, urinary tract infection, but also can come from non-infectious conditions. So some people with non-infectious conditions like deep vein thromboses, connective tissue disease like lupus or rheumatoid arthritis, variety of other similar conditions, vasculitis, cancer, side effect of a medicine may well do this. Now we know that you can have an infection without developing a fever. You can have a blunted febrile response. That occurs in newborns and the elderly, and then in people who have chronic liver disease, chronic kidney disease, people who are taking steroids, prednisone, to treat asthma or to treat their inflammatory bowel disease, people who are taking the anti-cytokine therapies that we'll talk about in a moment. Well, other non-infectious conditions could be pericarditis, inflammation of the sac around the heart, or trauma, or stroke, or even just receiving routine immunization might lead to an increase in the body temperature. When we talk about those cytokines, the medicines that are used now so commonly to treat inflammatory bowel disease, rheumatoid arthritis, or psoriasis, they blunt the production of the cytokines. So again, even a small elevation of body temperature may herald a significant infection in those individuals. And you can get a febrile response if you happen to have the gout. If you're taking a therapy for the gout, allopurinol, certain of the antihistamines or penicillin or dilantin or the sulfa drugs, a series of other drugs, may lead to an increase in body temperature. Well, one of the most important things is to realize that if you do have a fever, there are several different manifestations. We talk about 5 different types of fever. We talk about intermittent fever. So in intermittent fever, your temperature comes back to normal every day. So that would be, for instance, if you had a problem like bacteria in the bloodstream, sepsis. Or we have remittent fever, where the body temperature falls, but it doesn't fall back down to normal. That might signal endocarditis. Or you can have a continuous fever, a sustained fever. It doesn't seem to vary much. It stays elevated, say at 102 or 103 degrees. That might signal a type of pneumonia or urinary tract infection. We can have hectic fevers. We can have relapsing fever. And there's certain kind of conditions that seem to lead to certain forms of fever. So if you have fever every 3 days, might be a type of malaria known as Plasmodium vivax. On the other hand, Plasmodium malariae, another type of malaria, might have elevation of fever every 4 days. Or you could have relapsing fever, several days with fever, then several days without fever. Pell-Ebstein fever, that's relatively common in lymphoma and in Hodgkin's disease. You have fever for 3 to 10 days, then you're back to normal for 3 to 10 days, then you have more fever for 3 to 10 days. If you have cyclic neutropenia, you tend to develop a fever every 21 days. Well, the question is, how do we treat the fever? Well, most fevers are associated with self-limited infections, so you don't really need to use any kind of medicine. But the medicines tend to be not contraindicated, so if you happen to want to use the acetaminophen or the non-steroidal anti-inflammatory drugs, there's no evidence that they really cause significant harm other than the drug toxicity that they might engender. Well, if you happen to have a bacterial infection, there might be a reason not to want to use those medicines, because if you're taking the antibiotics, you want to see if the antibiotics are working. One of the simple ways to know if the antibiotics are working is to watch the temperature come back down to normal. If it doesn't come back down to normal, then you need to change the antibiotic. But if you're taking medicine to reduce the body temperature, that can mask your progress. And then there are some people who have what we know as drug fever or factitious fever, and it's important to know the pattern of the fever in those individuals. And again, that would be a reason not to use some kind of therapy. But if we do want to use the therapies tend to reduce the prostaglandins, reduce that COX enzyme. That's the way the aspirin and the nonsteroidal anti-inflammatory drugs like the ibuprofen or the naproxen or the Celebrex or the Mobic, they all work that way. Acetaminophen probably works a little differently. It may well work on COX-3 enzyme actually inside the brain. Have to realize that all of these medicines do have some potential for side effects. They can affect the platelets. They can have something to do with the gastrointestinal system and the increase in the bleeding. Sometimes if you take the medicines, they can increase cardiovascular conditions. In children, aspirin can increase Reye's syndrome. If you're taking steroids, steroids are going to inhibit the prostaglandin E2. So you might not need to take medicine to reduce fever if you're already on the steroids. Well, if you're taking the medicine to reduce the body temperature, that might be important, especially if you happen to have heart disease or lung disease or central nervous system disease, because we know that with every 1 3/4 degree elevation in body temperature, you use 13% more oxygen. So that tends to put a stress on already damaged hearts and lungs and central nervous system. In children, they might have a tendency to develop febrile convulsions. Seems that they can be sometimes avoided. And as an added benefit, people who take some of the medicine to reduce fever, well, they can get rid of the headache and the muscle pain and the arthralgias that are associated. Have to realize that there's a wide range of inflammatory diseases, infectious diseases, all of which we have to consider. And then for a long time there was a condition known as fever of unknown origin, FUO. It was sort of brought to popular attention 1961, Petersdorf and Beeson. You had to have a temperature more than 101 on at least 2 occasions. And you had to have that for a period of about more than 3 months. Had to be hospitalized, had to be evaluated. Now we tend not to hospitalize people, and as a matter of fact, we find that fever of unknown origin tends to be caused by atypical presentation of relatively common diseases, not due to very rare diseases. So atypical presentation, for instance, of endocarditis or diverticulitis or osteomyelitis of the vertebrae or pulmonary, extrapulmonary tuberculosis. FUOs only found about 20% of the time in the United States due to infectious diseases, more commonly neoplasms, cancer, autoinflammatory diseases, granulomatous diseases, cat scratch disease or histoplasmosis or sarcoidosis, or vasculitis or connective tissue diseases, incidents outside the United States. Well, infectious diseases account for almost half of the FUOs. And interestingly, in the underdeveloped areas of the world, tuberculosis is still a major cause. About half of the cases outside the United States due to some other condition, another condition that's not due to an infection, but rather is due to cancer or some of those inflammatory diseases I mentioned. Well, then we have a condition where certain of the infections are associated with rashes. And then we have to evaluate those. So for instance, in measles and in a variety of the childhood illnesses, those are all associated with rashes and fever, and they're sort of classic. Well, when it comes down to it, we have a very complicated story of fever. It's very common, it's misunderstood, and right from the start you have to realize that 98.6 is not the average temperature. Temperature is a body range. It tends to be lower in the morning, tends to be higher in the afternoon. Elevation of body temperature tends to be due to a cascade of events, sometimes due to infections, sometimes due to inflammatory diseases, immune diseases, all of which have to be considered. If you do have elevation in the body temperature, should you take something to reduce the temperature? Well, it's sort of optional. Doesn't seem to cause any significant harm as long as you're not talking about the side effect of the medicine. But again, doesn't seem to cause any significant benefit unless a person is suffering from myalgias and arthralgias, a variety of other conditions. But remember, it can mask the progress of our antibiotic treatment of infection. So anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified when we post new videos. I appreciate your interest. I'm Dr. Ken Landau.